It's the turning point authorities feared.
First person to die.
Evacuated from the Diamond Princess.
James Kwan, Australia's first COVID-19 victim. He died on the 1st of March 2020.
There are now 27 coronavirus cases.
Thought to be from human to human transmission.
Back then, it wasn't even labelled a pandemic, and we had no idea how big it would become. In the 2 years since, about 5,000 Australians have died with COVID-19, the vast majority during the Delta and Omicron waves. Today, we're asking the hard questions. How many deaths are too many? And as the toll gets higher and higher, is there a number that could make us change course? This is a tough one to unpack, but to start, let's look beyond COVID at what takes the lives of Australians each year. 2019 is a good case study since it wasn't affected by the pandemic. Here's a list of the biggest killers in 2019. Heart disease took the top spot, responsible for about 10% of all deaths. Dementia was responsible for 9%. Scroll down a bit to diabetes at number 7. It killed about 5,000 people, about the same as COVID across the entire pandemic. But it's not like we sit around and accept those deaths.
Everyone's going to die, that is for sure. But nevertheless, we treat many diseases, many patients who have many other conditions.
If you've got measures that you could put in place that could dramatically reduce deaths in particular areas, then they're the low-hanging fruits that you will invest in.
What's interesting is that with COVID public health measures, Australia actually had fewer deaths than we would have had without a pandemic.
The reason is that we were socially isolated. In many instances, we were locked down. People were not getting common respiratory infections. People were also taking their own chronic diseases much more seriously.
So in a way, the pandemic, or our response to it, actually saved lives in Australia. This is a graph showing the excess deaths over the past few years. The black line shows how many people are expected to die each week. The orange line shows how many people really did die. Anytime the orange line goes above the shaded area, which accounts for random variation week to week, that's called excess mortality, or more deaths than expected. So we can see in the winter of 2017, the flu season was particularly bad, with about 1,500 excess deaths. Let's compare that to when COVID first came ashore and lockdowns were put in place. The total death rate fell significantly below the expected range for the first time since at least 2015.
I do expect that we will start to see the number of excess deaths rise. There have been many things we've done during the pandemic to protect elderly, frail people that are not sustainable. But as a consequence, those people have actually lived longer than they might have lived otherwise.
And it's not just here in Australia where that seems to have happened.
It's only because levels of immunity are so high and deaths are now, if anything, below where you would normally expect for this time of year that we can lift these restrictions.
It's all well and good to say that, but is it true? Well, at the start of the pandemic, when the virus was out of control in the UK, there were thousands of deaths beyond what would normally be expected each week. But lately, it's dropped below normal levels. Vaccines and changed habits played a large part, but a big factor is the earlier deaths of people who were frail and close to dying already.
It's already infected the people that it's going to have the greatest harm in. The people subsequently who it can infect are people more robust. They are less likely to die from it. And so we see this negative dip.
Language has proven to be a big part of this crisis. The days of
787,
183,
818,
1,838,
1,220 cases
are over.
While you don't want infections in the community if you can avoid it, you can actually tolerate them. You don't have to go to such extreme lengths to try and keep the virus out completely.
The focus now is on deaths and hospitalisations, which is totally normal when it comes to how public health decisions are made. When governments decide whether to fund a new cancer treatment or weigh up the cost of a public health campaign, the analysis to support that decision doesn't just look at how many lives it will save, but crucially at how many potential life years are saved. Basically, if an intervention saves the life of a 40-year-old, it will save a lot more life years than if it saves the life of an 80-year-old.
Oh, I think it's irrelevant and a slippery slope, in fact, to qualify someone's death, to almost semi-excuse it by their age, by their comorbidity.
Research found that in the first 8 months of 2020, each COVID death in Australia on average resulted in a loss of 2.7 life years. We did much better than other countries. In Peru, where many younger people died, each COVID death there resulted in a loss of 15.2 life years on average, or in Brazil, where it was 12.8. In 2020, the only data available so far, 900 Australians died from COVID and more than 4,500 years of potential life were lost. Some experts say there needs to be a change in thinking, and like the reporting of daily case numbers, the reporting of daily deaths isn't contributing to a useful debate in Australia.
We saw serious illness and particularly deaths as a sign of failure in those early times. Now we're shifting our understanding of risk.
I think we've just had the completely wrong spin on the death numbers. We need to bring it back into a perspective that actually takes into account the risk factors. In many regards, it's a part of life that we have accepted for decades. It's not something that we now need to fear and sweep under the carpet.
First it was, don't look at cases don't matter. Then it was don't look at hospitalization doesn't matter. And now it's don't look at death, because death doesn't matter.
There's really no answer to the question of how many deaths are okay.
Are we doing all we reasonably can do to minimise deaths from COVID, just like we do for our road toll, for example?
We're no longer anywhere near as vulnerable as we were in February 2020. So we have to adjust to that. That should give us confidence that we can control this. But we shouldn't in the process say, we want to guarantee zero deaths. That's just, you can't deliver that. We don't deliver it with any other disease. It's not about going back to zero virus. And certainly with that, then we can't guarantee no deaths.
With the virus here to stay, experts agree the best way to improve the outcomes with COVID is to improve the underlying health of the population.
There are some very straightforward steps people can take to minimise the risk of having a terrible outcome from COVID-19 and from those chronic diseases. And I think it's really important that we understand that chronic diseases are what makes us vulnerable to death.
If we can remember some of the lessons we've learnt along the way, then we can not only limit the transmission of COVID, but also a number of other diseases that cause death in our society all the time. That may be a long-term silver lining in this cloud.